We become trauma therapists because we want to help others heal. And we don't initially expect that what that means is that we're going to be confronted with trauma-related images and stories, sometimes for 6 to 8 hours a day. This can take a significant toll on our minds and bodies and our overall sense of well-being. Another thing to think about is that when we are working with others, we often end therapy as soon as the distressing symptoms have resolved. Well, on the one hand, that's good, but we don't really get to see the full potential or the integration phase of our client's trauma recovery, right? When we get to ride through the later stages of treatment, we get to see what happens when their resilience is supported, when they can move into post-traumatic growth or grow into their potential. When we don't get to join them in that stage of the treatment, we're just running from working through the difficulty to baseline, working through the difficulty to baseline. We end up feeling a little bit more depleted. In fact, sometimes quite a lot more depleted. So while you may have heard of post-traumatic growth, you might not know how to get your clients there. There is a roadmap to resilience and growing into our potential. There's this really interesting oft-cited quote from Freud, who said that much has been gained if we succeed in transforming neurotic misery into ordinary unhappiness. I think we can do better than that. My name is Dr. Arielle Schwartz, and I am a clinical psychologist, a somatic therapist, trauma treatment expert, and I've been a yoga teacher for about 30 years. I am the founder of Resilience-Informed Therapy, which is an integrative mind-body approach to care that synthesizes together relational therapy, applied polyvagal theory, somatic therapy, parts work therapies, and EMDR therapy into a holistic and strength-based approach to trauma recovery. Now, how did I arrive here in my work? It began with my own story of burnout. I initially was working in the field as a trauma treatment expert. I had graduated from my somatic psychology program. I had integrated EMDR into my work, and I was working in community mental health for long hours in the day. And I also was seen as a young and vibrant and capable therapist and was often receiving referrals of some of the most difficult clients. But I also observed is that many of the clinicians who had been in community mental health for a long time were very burnt out. They didn't have the energy, and that's why I was getting some of these clients. Now, what I began to notice in myself is that vicarious trauma is real, and I started to feel the weight of focusing the lens on the distress, on the trauma, of hearing these hard stories day after day. And I started to experience my own burnout, my own depletion. And it wasn't just psychological, it was physiological. I would literally come home at the end of the day and I had nothing left to give, not to my friends, not to my family. I just wanted to lay on the floor. I coped with eating sugar. I coped with watching too much TV. And overall, this took a tremendous toll on my own sense of well-being. And then a few years later, I discovered the work of Marty Seligman and his work in positive psychology. His work was really initially about studying learned helplessness, and then he evolved his work into studying what he calls learned optimism. And he brought this work of positive psychology into the military. He eventually became the president of the APA. And what I started to do was incorporate these resilience-focused strategies into my work. And this began to dramatically change how I felt at the end of the day. It was broadening the lens beyond just the distress and the symptoms into the strengths, into the capacities and the resources. And I was feeling more vibrant at the end of my day. My clients were leaving sessions feeling more hopeful about the future. Let me tell you a little bit about a story of a client who really benefited from this work. We'll call her Stacy. And initially, Stacy was referred to me because she had a long-standing diagnosis of bipolar disorder. She had been treated for her bipolar disorder since she was in her late teens. She came to Colorado, which is where I live, and she started with a new psychiatrist. And what's extraordinary about this story is that he was the first person to ask her about her trauma history, ask her about a trauma history, which indeed she had quite a lot of. And so he referred her to me. And as we began to work together, I discovered that even though her presenting symptoms looked like bipolar, what was never being addressed was the experience of early neglect, early abuse, the suicide of a family member, the alcohol use of a family member, and the lack of protection in her home. So there was a tremendous amount of accumulated, what we refer to as complex traumatization. So as Stacy and I began to work together, even from the very beginning, I started to notice that she would drop into what we would call these kind of trauma states, these very encapsulated states, or we might even refer to these as parts of self, where she would feel profoundly hopeless. Now, before she came to see me, Stacy had been in and out of hospitalization. She had been suicidal. She was self-harming. And as we began to work together and we were really attending to how she would drop into these really difficult self states and emotions, we could hold in mind this experience of herself and what she went through as a little girl. Rather than becoming her, she could learn to tend to her, to care for her and nurture her. So we did a lot of practice on building self-compassion. And one of the key elements of the resilience-informed model is somatic integration of the positive felt sense of self. So not only was she visualizing caring for her younger self, but she embodied it. So there were times in which she was kind of holding this young self and just rocking her in her arms and gazing down at her, just imagining that baby. But at the same time, she was kind of rocking her own body. And you can see on my face, and what she was manifesting was the most beautiful, loving gaze on her face. So we're rewiring the social nervous system, the social engagement system, which is part of the polyvagal theory. It's kind of the most evolved portion of our vagus nerve that allows us to feel safe and social and connected. Another one of the approaches that I used with Stacy was something called self-havening touch. And this is, again, a integration through embodiment, but it's also a gentle vagus nerve stimulation because the vagus nerve comes close to the surface of your face. And when we're applying self-applied touch, we're actually stimulating neurochemicals and hormones like oxytocin and serotonin. So we're building a lot of the feel-good neurochemistry in the body. If self-havening is new to you, I'll guide you through it here just briefly so you can get a felt sense for yourself. So we begin by just allowing yourself to make contact between your hands. And you can do this nice and slow, just waking up the felt sense. And it's an experience of both giving and receiving touch at the same time. So allowing yourself just to trust in this contact. Now, the next layer of the self-havening touch is to bring your hands to your forehead, and just in the same way that you would smooth the forehead of a young child who is sad or distressed, allowing yourself to offer that care and touch to yourself from center of forehead out towards your temples. And then moving from the bridge of your nose out towards your ears across your cheekbones. And you don't need to go towards any firm or direct, pressure here. This is very much just a sweeping motion, and hopefully it feels good. The final placement of touch is from shoulders down to elbows. And this one has another element to it, which is that we're crossing midline with the arms. And as you feel this for a moment, just again, imagine like you're giving yourself a nice big hug and letting your hands move in that downward motion, shoulders to elbows. Perhaps tuning into those words, safe or safe enough, social, connected. And then releasing your hands down and just sensing what you feel in your body. Another key element to the resilience-informed approach is the integration of bilateral movement. One thing that was first discovered by Francine Shapiro, who developed EMDR therapy, was the importance of bilateral movement in healing trauma. In fact, EMDR therapy was initially inspired by a walk in the park. Francine was walking through the park. She was talking about something very difficult with a friend of hers, and she noticed that by the end of the walk, she felt better. She felt more uplifted, lighter, and she got very curious. Something else that she was noticing is that in walking, she was also allowing her eyes to kind of scan her environment, and her eyes were moving back and forth, which honestly naturally happens when we walk through the world. We're just not always aware of it. What I love about this story is that there was a movement component to that bilateral integration. And so often when we're trained as EMDR therapists, which as you know I have been for many years, we're trained with the client sitting still, and the only part of them that's moving are the eyes. And so in integrating bilateral movements into the resilience-informed approach, I've been experimenting with great success the integration of contralateral or bilateral movements, crossing midline with your movement. I'll share one example here that I use in my work, and again, you can join me experientially if you'd like. We'll start by placing your hands right at midline, right over your heart, and then allowing yourself to turn towards one side as your hand extends away and then back towards your body. Then we'll just switch to the other side. Away and back to center. And you can begin to integrate your breath and movement. And you can explore whether you want to inhale as you move away from midline, or if you prefer to exhale as you move away and inhale to midline. You might experiment with both and see what feels right for you. And a key element here is following your hand with your eyes. You come through midline, you cross midline, and you move the other way. And as you can see here, you can just allow your head to turn with the movement as well. And then when you feel complete, allowing yourself to come back to stillness. Now, in both of these tools, the self-havening touch or this heart twist, we are adding some movement, but these kinds of sensory experiences are amplified or embellished when we also add a psychological component to it. So, for example, bringing in a sense of self-compassion, or bringing in some kind of gratitude state or positive imagery from your life, so that we're really stacking the resources somatically and with visualization and with intention. Now, I want to tell you how Stacy's story ends, because as we worked together, we really navigated through some really hard material from her past, but we kept bringing in the resources of the self-compassion so that rather than dropping into that young self state, she was able to hold that self state. She was better able to hold that self state out in the world as well. And eventually, Stacy became a successful playwright, incorporating the journey of her mental health struggles and giving hope to others through the power of storytelling and performing. I see this in a lot of my trauma therapy clients. When they are supported to come all the way through the healing journey, this allows them to reach their full potential. You know, you may have heard of Maslow's hierarchy of needs. Maslow viewed self-actualization as this capacity to really come into your full potential, express who you are meant to be. But he also saw this as a rite of passage that allows us to go beyond the single self into what he referred to as self-transcendence. So self-actualization is about fulfilling our potential. Self-transcendence is about furthering a cause beyond the self. And maybe we sense it as this profound desire to protect the welfare of all people or to give back to our community. This is what we refer to as post-traumatic growth. I'm excited to partner with the Academy of Therapy Wisdom in order to share the resilience-informed therapy approach to trauma treatment with you. Let me tell you a little bit more about this 6-module course. In Module 1, we begin by discussing the toll that trauma treatment can have on us as mental health providers. Especially, we'll take a look at vicarious trauma and burnout. We are humans first. We come into this field with our own histories, and we, like our clients, are navigating this complex world that we share. We then really need to know how to take care of ourselves all along the way, and I'm going to give you those tools. In Module 2, we're going to look more closely at the toll that trauma can take on our clients' mental, emotional, and physical health. We're going to span the range of single incident to complex traumatization. We're going to discuss attachment and developmental trauma, as well as transgenerational and collective traumatizations. Most importantly, I want you to already be coming away with tools that can start to create stabilization in your clients and promote that positive, hopeful outlook toward their future. In Module 3, I'm going to offer you the applied polyvagal theory within psychotherapy. I've been teaching this model for about 15 years. I work with Dr. Stephen Porges and with the whole team there at the Polyvagal Institute, and I receive feedback on a regular basis that I provide a very understandable and grounded approach to teaching this scientific model. In Module 4, we're going to explore a wide range of resources from trauma recovery, drawn from somatic psychology, self-compassion research, and the science of positive neuroplasticity. And I'll provide you with an opportunity for experiential learning of somatic interventions to enhance embodiment. In Module 5, traumatic memory reprocessing is going to be our focus, and we're going to look at this through the integrative mind-body approach that incorporates somatic psychology and parts work therapies and elements of EMDR therapy. You'll have an opportunity to observe a demonstration session, which can help to make all of this theory more tangible. If you have worked with trauma, you know that healing is not a straight line, that there are going to be challenges that will arise along the way. And in the final module, we are going to discuss the common barriers that arise as part of our trauma treatment, and I'm going to guide you to help clients transcend those barriers. Resilience is not just about personal healing. It's about drawing on your own strength, your own capacity to serve others as you share insights and wisdom that you have gained on your healing journey. Resilience helps us as communities to pull together and to emerge stronger from tragedy. Please join me in this course. It will be such a pleasure to support you to learn the resilience-informed approach to trauma treatment that will not only enhance your well-being, but that of your clients and for our communities in this hurting world that is in such deep need of compassionate care.